Today, we explore Suboxone, a prevalent medication used in the treatment of opioid addiction. While recognized for its role in managing dependency, it's essential to understand its limitations. Suboxone is not a cure for addiction. It's a temporary measure, often substituting one opioid dependency for another. Our journey will uncover the truths behind Suboxone and set the stage for an innovative approach in addressing opioid dependency. Suboxone combines buprenorphine, a partial opioid agonist, with naloxone, an opioid antagonist. Designed to alleviate withdrawal symptoms and reduce cravings, it's often viewed as a safer alternative to full opioid agonists. However, it's critical to recognize that Suboxone itself is an opioid, and its use can lead to another form of dependency. Opioid treatment has evolved significantly over the years. Suboxone emerged as a response to the urgent need for harm reduction and safer opioid addiction treatments. While it marked a step forward, offering a controlled approach to manage withdrawal symptoms, it also highlighted the ongoing challenge in finding a lasting solution to opioid addiction. Suboxone works by partially stimulating the brain's opioid receptors, offering relief without the high of stronger opioids. This mechanism is effective in reducing withdrawal symptoms, but it also poses a risk of long-term dependency, leaving patients in a state of sustained opioid use. While Suboxone is used medically to ease the journey off stronger opioids, its story is complex. The potential for creating a new dependency and the risk of misuse are significant concerns. These factors highlight the challenges in treating opioid addiction with Suboxone and similar medications like Subutex and methadone, where the line between treatment and dependency is often blurred. Suboxone's introduction has been both beneficial and controversial. It has reduced harm from opioid addiction and overdose for many patients, but it's also raised ethical questions about opioid replacement therapy. Along with a growing number of medication-assisted treatments is a growing amount of opioid-dependent individuals. Bottom line, the opioid epidemic is still getting worse and worse. Withdrawal from Suboxone is a significant aspect of its use. Symptoms can range from mild to severe, affecting both physical and mental health. Common withdrawal symptoms include nausea, muscle aches, sweating, anxiety, and insomnia. More severe cases can lead to symptoms like depression, agitation, and intense cravings for opioids. The process of tapering off the medication can be challenging, often raising questions about whether it's a solution or a perpetuation of opioid dependency. The use of Suboxone in special populations, such as pregnant women and adolescents, presents unique challenges and considerations. This section will explore the risks, benefits, and ethical considerations of using Suboxone in these vulnerable groups. As we consider the long-term use of Suboxone, it's crucial to understand its multifaceted impact. Prolonged use of Suboxone can lead to several physical and psychological effects. Physically, individuals may experience symptoms like chronic fatigue, hormonal imbalance, and potential liver damage. Psychologically, long-term Suboxone use can be associated with mood swings, depression, and an overall decrease in emotional well-being. These effects raise significant concerns about the quality of life for individuals on Suboxone, especially when used as a long-term solution. The risk of persistent opioid dependency, despite a switch from more potent opioids to Suboxone, is a profound challenge. It underscores the need for treatments that not only manage addiction, but also promote holistic long-term recovery and well-being. Understanding these long-term effects is vital in assessing the true value and limitations of Suboxone as a treatment option. So, what are the treatment options that are available? There are a couple of popular treatments often offered to patients struggling with Suboxone addiction. As we mentioned previously, medication-assisted treatment using drugs like Suboxone or methadone replaces one opioid for another rather than treating your opioid dependency. Worse than that, those replacements can easily cause even more serious dependency along with stronger withdrawals. The first option includes either staying in a long-term rehab center, a detox facility, or any other related therapy, which includes methods such as a support group or a 12-step program. In these care facilities, the primary goal is to help relieve the withdrawal symptoms instead of treating the lifelong dependency. It's not surprising that 70 to 80% of the participants relapse within a few months after treatment. The second option is to undergo detox or rapid detox, where the goal again is to treat the withdrawal and not the root of the dependency, making this treatment ineffective in the long run. Ultimately, Suboxone addiction should be treated at its biological root, the brain. With the ANR treatment, we can evaluate each individual and restore their own neurological and chemical balance to a pre-dependency state, effectively eliminating their withdrawals and cravings without the need for long-term replacement medications. ANR defeats opioid dependency at its root. ANR treatment stands as a revolutionary approach in the world of opioid addiction recovery. Unlike opioid replacement therapies, ANR focuses on the neurological and biochemical imbalances in the central nervous system, offering a definitive solution to opioid dependency. Our exploration of Suboxone has revealed its role and limitations in treating opioid dependency. As we turn towards treatments like ANR, there's a growing hope for an ultimate solution to opioid addiction. Don't forget to subscribe, like, and share for more enlightening health content. Your support helps us bring more awareness to these vital topics.